Paul Getze lives in Plumboro, Pennsylvania. He works for a Pittsburgh company that sells respiratory medical devices. And in 2008, he woke up one day to find out he had completely lost his hearing in one ear.
It was a normal day. It was February. I got up, I went to work, got my first phone call, went to answer it, and I'm like, that's funny. The phone's not working. I can't hear. So I went to another office, dialed the phone. I'm like, well, that's really weird. This phone's not working either. And then I started walking around like, well, that's funny. Other people are on the phone. And then I realized it wasn't the phone that wasn't working. It was I couldn't hear. So it was a spontaneous loss. They can't explain it. They call it idiopathic loss. This is the charging unit that comes with the system.
In Paul's case, the hearing loss was permanent, and his treatment options weren't promising.
You're listening to your doctors, and they're telling you they can't help you, so there aren't a whole lot of options. But being from the medical field and also being in the technology field, I says, well, wait a minute, there's got to be something out there.
Paul kept searching, and while conducting a routine internet search, he stumbled across a viable solution to his hearing loss. He took it to his doctors at Allegheny General Hospital and made headlines by becoming one of the first users of a unique device that combines dentistry with audiology.
People say, well, how do you hear with your teeth? And that's sort of the angle. It's a very interesting technology.
Today, Paul has advice for other patients facing a difficult situation.
Take ownership of your particular situation, right? Go out, do the research, keep an open mind, but I say trust but verify. You got to be careful. You know, again, I talk to a lot of people. There's a lot of good bulletin boards and blogs and that sort of thing going out there. You sort of have to be very conscious of what you're reading.